Hello and welcome. My name is Renee Riles. I am a Medicare sales representative with Capital Health Plan. During this presentation, we will talk about Capital Health Plan Silver Advantage HMO, Capital Health Plan Advantage Plus HMO, and Capital Health Plan Preferred Advantage HMO, which are all Medicare Advantage HMO plans. Capital Health Plan offers another Medicare Advantage plan called Retiree Advantage. Retiree Advantage is offered by certain large employer groups, and it allows Medicare-eligible retirees to continue their employer coverage. The groups offering Retiree Advantage include the state of Florida, city and county governments in the service area, school boards in the service area, plus Tallahassee Memorial Hospital and Tallahassee Community College. If you are a member of one of these groups, you may want to attend our Retiree Advantage presentation as well. We were the first health maintenance organization and nonprofit health plan in the area. We enjoy an affiliation with Florida Blue and the Blue Cross Blue Shield Association. You will see their logo on our member materials. We are very proud of the fact that Capital Health Plan has received 4.5-star rating out of 5 stars from the Centers for Medicare and Medicaid Services for 2020. Medicare evaluates plans based on a 5-star rating system. Star ratings are calculated each year and may change from one year to the next. Star ratings are based on quality and performance. Additional information on plan ratings is available at www.medicare.gov and in your enrollment guide. You become Medicare eligible at age 65, or you may become eligible earlier due to a disability or end-stage renal disease, which is permanent kidney failure. To enroll in Medicare, contact the Social Security Administration. The address and office hours and phone numbers are on this slide. You can contact the Social Security Administration up to 3 months prior to your Medicare effective date. However, you will automatically be enrolled in Medicare Parts A and B if you are receiving Social Security benefits prior to becoming Medicare eligible. See our Medicare Made Easy brochure that is located on our website, www.capitalhealth.com/Medicare, for additional information about how and when to enroll in Medicare. With Medicare, you have choices in how you receive your medical and prescription drug coverage. You may choose to have Original Medicare through the federal government, which is Medicare Parts A and B. Because Original Medicare does not cover prescription drugs, individuals must purchase a separate prescription drug plan, which is Medicare Part D. Some individuals also choose to purchase a supplement or Medigap plan to pay costs that Medicare does not cover. Capital Health Plan does not offer standalone prescription drug plans or supplement plans. Another option is to choose a Medicare Advantage plan, which is Medicare Part C, like Capital Health Plan Silver Advantage, Advantage Plus, or Preferred Advantage HMO. A Medicare Advantage plan contracts with the federal government to become responsible for your Medicare benefits and services. Our Medicare Advantage plans provide your hospital, physician, and outpatient coverage along with prescription drug coverage, which is Medicare Part D, all in one plan. You pay copayments or coinsurance when you access services, and Capital Health Plan pays the healthcare providers. There are other options as well for individuals who have VA benefits, TRICARE, or employer plan coverage. To be eligible to enroll in Silver Advantage, Advantage Plus, or Preferred Advantage, you must be entitled to Medicare Part A and enroll in Part B. You must continue to pay your Medicare Part B premium to the federal government. This means you will pay both the Medicare Part B premium, which is typically deducted from your Social Security benefits, and the Capital Health Plan premium. And you must live in the service area, which includes the Florida counties of Calhoun, Franklin, Gadsden, Jefferson, Leon, Liberty, and Wakulla. These are the only enrollment requirements. You will not use your red, white, and blue Medicare card while you are on Capital Health Plan member. We will send you an ID card that you will use to access your care. You are still enrolled in the federal Medicare program, meaning you have all the rights and protections of the federal Medicare program while Capital Health Plan is providing your Medicare benefits and services. When you join a Capital Health Plan Medicare Advantage plan, you must use Capital Health Plan network providers except in emergency or urgent care situations or for out-of-area renal dialysis. There are also times when you may receive prior approval to go to out-of-network providers. Routine care from out-of-network providers will not be paid by Medicare or Capital Health Plan. We have over 450 physicians, including primary care providers, other facilities, including exclusive access, and about 300 specialists in our network. Capital Health Plan has a very well-established, stable network of providers, and we have a good relationship with the medical community. You are most likely already seeing a Capital Health Plan network physician. If you need a primary care physician, you can choose a primary care physician from the Physicians Group of Capital Health Plan located at our Governors Square Health Center, Centerville Place Health Center, and our new Metropolitan Boulevard Health Center. Or you may choose an affiliate physician who has a private practice that we contract with. Referrals are not normally needed for office visits or consultations with network specialists. If a specialist recommends additional services, office visits, diagnostic tests, surgery, hospitalization, or other specialty care, you may need an authorization from Capital Health Plan. You can always contact your primary care physician or Capital Health Plan member services if you have questions about the referral or authorization process. For a complete list of network providers, visit our website at www.capitalhealth.com/Medicare or call member services. The provider network may change at any time. You will receive notice when necessary. You can use our local hospitals, Tallahassee Memorial Hospital or Capital Regional Medical Center. Select Specialty Hospital is in our network and located in Tallahassee as well. The Calhoun Liberty Hospital in Calhoun County and Weems Memorial Hospital in Franklin County are both in network for emergency, stabilization, and transfer services. We also work with Shands in Gainesville and other centers of excellence on a case-by-case basis. Services at these hospitals require approval and authorization. Capital Health Plan members use LabCorp laboratory services. There are facilities throughout Tallahassee, including one in each of our health centers. You may use any LabCorp in the country. You can schedule appointments at some LabCorp facilities by calling or visiting their website. We have also contracted with facilities in a few of the other counties to provide lab services for member convenience. Capital Health Plan's pharmacy network includes all the major retail chains as well as some of the smaller local pharmacies. You may use any network pharmacy nationwide. We also have a mail order pharmacy through Prime Therapeutics who contracts with Walgreens Mail that you may use. There is a cost savings if you order a 90-day supply of your maintenance drugs through mail order. The network also includes long-term care pharmacies and home infusion drug coverage. You must use network pharmacies except under non-routine circumstances. You can visit our website at www.capitalhealth.com/Medicare for a complete listing of pharmacies or call member services for assistance. The pharmacy network may change at any time. You will receive notice when necessary. Emergency care and urgently needed care are covered anywhere in the world. You are not required to use Capital Health Plan providers in these situations or call first for an authorization. You should go to the closest urgent care facility or emergency room. You will show your Capital Health Plan identification card, and it is helpful if you can call Capital Health Plan member services within 2 days of accessing inpatient care outside of the area. One thing to note is that we are not allowed to cover Part D prescription drugs at retail pharmacies outside of the United States. The definition of medical emergency and urgently needed services is on this slide. Capital Health Plan provides options for urgent care when immediate help is needed, but not serious enough for emergency room and your primary care physician is not available. Same-day appointments are available by phone at Capital Health Plan's urgent care at our new Metropolitan Boulevard Health Center. Urgent care is open Monday through Friday from 11 a.m. until 10 p.m. and on Saturday and Sunday from 9 a.m. until 8 p.m. Holiday hours may vary. Telehealth through Amwell provides urgent care at any time from right where you are. The Amwell app gives you access to a doctor 24 hours a day, 7 days a week, and 365 days a year. See the doctor one-on-one via smartphone, tablet, laptop, or desktop. Your guide to enrollment includes a summary of benefits. For each benefit listed, you can see what your out-of-pocket costs will be. Our members receive all of the benefits that Original Medicare offers, plus additional benefits. The enrollment guide also includes an enrollment application, an envelope to return the application, an enrollment checklist, and additional information about our star rating. It is important to remember the enrollment checklist, which will tell you how to enroll. Please take the time to read the Guide to Enrollment for additional coverage and cost-sharing information. The monthly premium amount for Silver Advantage is $0. Advantage Plus is $35, and Preferred Advantage is $97. You pay this amount to Capital Health Plan. Like we discussed earlier, you must continue to pay the Medicare Part B premium to the federal government. This slide and the next slide compares Capital Health Plan Silver Advantage, Capital Health Plan Advantage Plus, and Capital Health Plan Preferred Advantage. The next two slides list your out-of-pocket costs for medical services. There is more detail in the summary of benefits that is included in the enrollment guide. We will discuss prescription drugs separately. For most services, you will pay a copayment, which is a flat dollar amount, or a coinsurance, which is a percentage of the cost. Most of your out-of-pocket costs are copayments, so you know how much you will pay prior to accessing services. It is important to know that all the plans cover the same services, but there are differences in your out-of-pocket costs between the three plans. These are the differences you need to understand to make a decision about which plan will be best for you. There are no deductibles for our plans. There is a $3,400 annual medical out-of-pocket maximum for all three plans. This is the maximum of copayments and or coinsurance you will pay for covered medical services in the calendar year. Most members will not reach $3,400 in a calendar year, but if you do, you will not pay for the covered medical services the rest of the year. Outpatient Part D prescription drugs are excluded. For Silver Advantage, the inpatient hospital copayment is $300 per day for days 1 through 6, with a maximum copayment of $1,800. For Advantage Plus, the inpatient hospital copayment is $250 per day for days 1 through 5, with a maximum copayment of $1,250 per admission. For Preferred Advantage, the inpatient hospital copayment is $300 for each stay. Skilled Nursing Facility has a $20 per day copayment for the first 20 days, then $150 per day copayment for days 21 through 100 with Silver Advantage. Advantage Plus has a $20 per day copayment for the first 20 days, then $100 per day copayment for days 21 through 100. And Preferred Advantage has a $20 per day copayment for the first 20 days, then a $75 per day copayment for days 21 through 100. The copayment for a primary care physician is $10 per visit for all 3 plans. The copayment for a specialist is $50 per visit for the Silver Advantage plan, $40 per visit for the Advantage Plus plan, and $25 per visit for the Preferred Advantage plan. The copayment for pulmonary rehabilitation is $30 per visit for Silver Advantage and $20 per visit for Advantage Plus and Preferred Advantage. The copayment for cardiac rehabilitation is $50 per visit for Silver Advantage, $40 per visit for Advantage Plus, and $25 per visit for Preferred Advantage. The copayment for procedures in a doctor's office or ambulatory surgical center is $250 per visit for the Silver Advantage plan, $150 per visit for the Advantage Plus plan, and $100 per visit for the Preferred Advantage plan. The copayment for services provided in an outpatient basis in a hospital is $350 per visit for the Silver Advantage plan, $300 per visit for the Advantage Plus, and $200 per visit for the Preferred Advantage. There is no cost for the Medicare-covered preventative services such as your annual flu shot. Emergency room copayment is $120 per visit. Urgent care copayment is $20 per office and telehealth visit. The copayment for each telehealth visit through Amwell is $15. Diabetes testing supplies is $0 for preferred brands Essentia and LifeScan brands and has a 20% coinsurance for all non-preferred brands. Durable medical equipment has a 20% coinsurance. The copayment for CT, MRI, PET, thallium, and nuclear cardiology scans is $100 per visit. There is no copayment for routine and diagnostic lab and X-ray services. Part B drugs has a 20% coinsurance. There is more information about these services in the summary of benefits. Capital Health Plan uses a formulary which is a list of covered drugs. Some restrictions may apply to some of the covered drugs. The restrictions include prior authorization, which means you need to get approval before you fill a prescription, and quantity limits, which means the amount of drug will be limited unless you receive an exception, and step therapy, which requires you to try certain drugs before we will cover another drug for the condition. Additional information about these restrictions for each drug are in the formulary. If you find that your drug is not on the formulary, you can ask your doctor to prescribe a similar drug that is covered, or you can ask Capital Health Plan to make an exception and cover your drug. There are several types of exceptions, which include the ability to receive a temporary or transition supply of a drug if you are a new member, or if your drug is no longer on the formulary while we work with your physician to find another drug. Both brand name drugs and generic drugs are included on the formulary. The drugs in our formulary are organized into different drug tiers. Your copayment or coinsurance depends on which tier your drug is in. You can look up each drug by name in the index in the back of the formulary. The index will give the page number where you can locate the drug, find the drug tier, and any type of restrictions that may apply to the drug. You may also search by drug name on our website. Please note that the Silver Advantage Plan has a separate formulary from the Advantage Plus and Preferred Advantage Plan. For the most recent formulary, visit our website at www.capitalhealth.com/Medicare. You can also call member services who can assist you. The formulary may change at any time. You will receive notice when necessary. Medicare prescription drug coverage is divided into 3 stages: the initial coverage stage, coverage gap stage, and the catastrophic coverage stage. The program structure and thresholds to get in and out of the gap stage are determined by the federal government each year. The copayments and coinsurance may be different from plan to plan. It is helpful to know this if you are comparing plans. This slide describes the initial coverage stage in which you pay copayments or coinsurance for your prescription drugs. There is no deductible amount to pay before coverage begins. You will pay the copayment or coinsurance based on the tier level for your prescription drug until the total cost of your drugs reach $4,130, which is paid by you and Capital Health Plan in the calendar year. $4,130 is the initial coverage limit for 2021 and can change each year. For a 30-day supply at the retail pharmacy, you will pay $3 for Tier 1 preferred generic drugs, $7 for Tier 2 generic drugs, $45 for Tier 3 preferred brand drugs, $95 for Tier 4 non-preferred brand drugs, and a 30% copay for Tier 5 specialty drugs. The specialty drugs in Tier 5 cost at least $670. Select Care drugs have a $0 copay. Please be aware that all tiers include generic drugs. You can get up to a 90-day supply of your maintenance drugs at the retail pharmacy or from our mail order pharmacy, and you will see there is a cost savings for 90-day mail order supplies using our preferred mail order pharmacy, Alliance RX Walgreens. For Select Care drugs, you will receive a 100-day supply. You may also receive less than a month's supply of certain drugs when appropriate, which can help reduce cost and waste. Your physician will help decide when this is appropriate. Copayments and coinsurance information for other day supplies are located in the summary of benefits. Most members will never leave the initial coverage stage. To determine if you might reach the $4,130 threshold, you will need to know the total cost of your drugs. You can get an idea of the cost of your drugs by asking your pharmacy or go to Medicare.gov, where there is a tool available to help you calculate the cost of your drugs while comparing plans. As an example of how this works, let's say your copay is $45 for a drug and the total cost of the drug is $90. This means that you and Capital Health Plan have both paid $45 for each of the total of $90. $90 would apply to the initial coverage limit of $4,130. Next, we will talk about the coverage gap. If the cost of your drugs reaches $4,130 during the calendar year, you go into the coverage gap stage, which is also known as the donut hole. The amounts you pay for your drugs may change at this point. If you enroll in Capital Health Plan Advantage Plus or Preferred Advantage, you will continue to pay the same $3 copayment for Tier 1 drugs and $7 copayment for Tier 2 drugs while in the coverage gap. Select Care drugs are $0 for Silver Advantage, Advantage Plan, and Preferred Advantage plans. You will begin paying 25% for all other generic drugs and 25% of the cost plus a dispensing fee for brand drugs until your yearly out-of-pocket drug costs reach $6,550. The third stage is the catastrophic coverage stage, and it is the same for all three plans. If you reach $6,550 in total out-of-pocket expenses, including the manufacturer's discount, you will pay the greater of 5% coinsurance, or $3.70 for generic drugs, or $9.20 for brand drugs for the remainder of the year. Some individuals with limited incomes and resources may be eligible for a federal program called Extra Help, or also known as low-income subsidy, which reduces prescription drug premiums and copayments or coinsurance. To see if you qualify for Extra Help, contact Medicare, the Social Security Administration, or Medicaid. The contact information is provided on this slide. These benefits are not covered by Medicare, but are covered by our plans. Routine hearing and eye exams are covered annually. You can receive up to $150 reimbursement every 2 years for the cost of eyeglasses or contacts based on date of service. You can also receive up to $150 reimbursement each year for membership to a health and fitness program or classes. There is a wide variety of programs that are covered, including TOPS and Weight Watchers. Some restrictions apply. Members have access to our health information line 24 hours a day, 7 days a week. You can talk to Capital Health Plan healthcare professional about your medical conditions. Dedicated staff are available to provide information and resources regarding issues such as prescription and non-prescription drugs, available self-management tools, wellness and nutrition, and preventative care. Amidst COVID-19, members now have access to additional telehealth services for primary care, urgent care, and select specialists. Telehealth or online video visits allow you to keep up with important healthcare appointments from your comfort of your home. We have an online program, CHP Connect, which gives members secure access to personal health records as well as valuable preventative health tools. CHP Connect maintains a personal history of your doctor visits, diagnosis, some lab results, plus much more. There is a healthcare library as well. You also have access to Symptom Checker, which allows you to input information regarding your symptoms, then provides related information or recommendations to seek care based on the results. Anyone can actually use Symptom Checker link, which is located on our website at www.capitalhealth.com. If you are new to Medicare, your initial enrollment period is a 7-month period that includes the 3 months prior, the month of, and 3 months after your birth month or eligibility month. If you enroll in Medicare or a Medicare Advantage plan during the 3 months prior to your eligibility or birth month, your Medicare will become effective the first day of eligibility or your birth month. If you delay enrolling until after your eligibility or birth month, your effective date can be delayed 1 to 3 months. There is information about enrolling in Medicare in the Medicare Made Easy brochure that I mentioned earlier in the presentation. If you enroll during the annual enrollment period, your coverage will begin the first of the following month between October 15th and December 7th. Your coverage will be effective January 1. This is the time you can make any change or switch between Advantage Plus, Preferred Advantage, and Silver Advantage. January 1 to March 31 is the open enrollment period. Your coverage will begin the first of the following month. During this time, you are allowed a one-time change and can make various plan changes to how you receive your Medicare coverage. You must have a qualifying event for a special enrollment period during the year. Special enrollment periods include moving in or out of the service area, losing group coverage, entering or leaving long-term care, or a skilled nursing facility. Dual eligible members and members who receive extra help have a continuous special election period. Your coverage will be effective the first day of the month following receipt of your application. As we discussed, you can travel outside the service area and will have coverage for urgently needed care and emergency care. Some individuals have homes in other areas, which is fine as long as you don't leave the service area 6 months or longer. If you leave the service area 6 months or longer, we are required to disenroll you. This information is not a complete description of benefits. Contact the plan for more information. Benefits, premiums, and/or copayments, coinsurance may change on January 1 of each year. Limitations, copayments, and restrictions may apply. The material we reviewed today is for the 2021 plan year. You may be subject to a late enrollment penalty if you did not enroll in Medicare Part D plan when you first became eligible, or if you had a continuous period of 63 days or more when you are not enrolled in Medicare Part D plan or did not have credible coverage. Credible coverage could be an employer coverage, VA, or TRICARE. You may receive a letter from Capital Health Plan to verify prior coverage. Medicare accesses the penalty, but we are required to collect it by adding the amount to your monthly premium. This slide contains our contact information and hours of operation. Please feel free to contact us with questions or for assistance. Appointments are necessary to see a Medicare sales representative. If you have special needs, this and other documents may be available in other formats such as Braille or large print. To recap some of what we reviewed today, to be eligible to enroll in Silver Advantage, Advantage Plus, or Preferred Advantage, you must be entitled to Medicare Part A, enrolled in Medicare Part B, and live in our service area. To choose between Silver Advantage, Advantage Plus, and Preferred Advantage, review the differences in out-of-pocket medical costs. To see what doctors and other providers are in our network, look in the provider directory. To see what pharmacies are in the network, look in the pharmacy directory. To find out how your drugs will be covered, look in the formulary. To enroll in Medicare, review the Medicare Made Easy brochure. To enroll in Silver Advantage, Advantage Plus, or Preferred Advantage, follow the enrollment checklist that is in the enrollment guide. We now offer online enrollment at www.capitalhealth/Medicare. If you want to deliver your application in person and meet with a representative, please call and make an appointment. You can change plans each year during the annual enrollment period. You will also have an opportunity to change plans during the open enrollment period. Enjoy traveling out of the area since you are covered for emergencies and urgently needed care anywhere in the world. You can get prescriptions filled at network pharmacies anywhere in the United States, and all of the major retail pharmacy chains are in the network. Thank you for attending.